Thank you everyone for joining, of course. Happy Pride. As Meg said, my name is Rob. I'm the community and events lead here at PowerToFly. Super excited to be sitting down with three leaders from Bristol Myers Squibb. I've had the good fortune to host several other events with this amazing company in the past. I'm also a Jersey boy, born and bred, and Bristol Myers Squibb's global headquarters is in the Princeton, New Jersey area. So if anyone is joining from New York and New Jersey, if you're ever driving through that beautiful area, you're probably driven past their HQ over there. So just to tell you a little bit about today's conversation before I bring in our amazing speakers, Bristol Myers Squibb recognizes and celebrates the diverse experiences and views of their workforce. They encourage every employee to bring their authentic selves to work so they can fully engage in meaningful ways and drive the company's mission. And Bristol Myers Squibb's Pride Alliance is a vital part of that effort, helping to ensure a diverse and inclusive culture that empowers LGBTQ inclusion, awareness, and engagement. So I'm super excited to introduce you to some members of that Pride Alliance today. And actually, I'm going to let them introduce themselves. So can we go around? Paul, let's start with you and tell us a little bit about yourself, your role at BMS, and maybe a fun fact. Maybe you've acquired a COVID skill in quarantine or something else fun.
Sure. Can everyone hear me okay? Okay, great. So I'm Paul Shea. I actually lead full-time our Pride Alliance People and Business Resource Group here at Bristol Myers Squibb. It's a unique model we have for our employee resource groups that I'll talk a little bit about during our panel today. I've been here at BMS for 4.5 years now, and I've been in the pharmaceutical industry for 15 years. Most of my career has been in strategy and operations roles, primarily on the R&D side of our business, but some of my time also on the commercial side of our business as well. And what else? I live in New York City, so commute to Princeton during the week, except during the pandemic, of course. And a fun fact, I learned how to make pretty good chocolate chip cookies during the pandemic, and I certainly had my fair share of them.
Thank you. And that reverse commute, people love the reverse commute. So that's great. Patty, let's hear from you.
Thank you so much, and great to be with everyone. I'm Patty Doikis. Things move fast at BMS, and my title has changed since the slide. I was in the Bristol Myers Squibb Foundation for 20 years and really loved doing health equity work with our team there. And Kemi was part of that team at one point as well. And just in the past 2 weeks, I've stepped into a new role as Executive Director for Health Equity on the company side. So we're really looking at ways that BMS can more inclusively discover and develop and deliver our medicines, understanding that patients have very different journeys and very different needs. And so how can we meet them? So really great to be with you. And let's think a fun fact. Well, I didn't get too far, but I'm committed to continuing learning how to weave during COVID. So I just love textiles. I'm amazed by textile artists and anybody who can knit and weave. So that's what I've been trying to learn a little bit about.
That's amazing. Our director of marketing community is a hardcore knitter. So whenever she's on Zoom, you just see lots and lots of yarn behind her. Speaking of background, Kemi, your background is like on point. It's like almost like a fake Zoom background. It's so picturesque. But can you tell us a little bit about yourself and your role at BMS and some fun details?
Yes, definitely. Thanks, Rob. So I'm Kemi Oshandina. I've been at BMS for about 4 years now. Half of my fun fact that Patty already revealed is that I started my career at the BMS Foundation. But right now, in my current role, I'm an Associate Director of Health Equity and New Partnerships on our patient advocacy team. So going to be working very closely with Patty as well. I'm a pharmacist by training. But I also have some outcomes research background, and I started working at BMS in the corporate philanthropy side. I'm an immigrant by Nigeria, so global public health, Health equity has always been a real passion of mine, and really excited that that personal passion and the professional side of it has aligned with my career at BMS. I recently purchased a house in Philadelphia, a townhouse. So that's why I've been decorating, DIYing, HGTV, YouTube, you name it, I'm obsessed.
That's amazing. Yes, I became a homeowner a couple of years ago, and luckily there's lots of resources out there these days to go to. But welcome everyone. Now that we got to learn a little bit more about you, I'd love to learn a bit more about Bristol Myers Squibb as a company. You know, we're hearing obviously a lot about pharmaceutical companies these days with, you know, the pandemic, but, you know, I think it's still kind of a world that's mysterious to a lot of us lay people. So Paul, can you kind of kick us off and tell us a little bit more about Bristol Myers Squibb as a company?
Yeah, that's great. Thank you for that. I'm trying to put up, let me see if this works.
Yep, we're seeing them now.
You're seeing our slides. Awesome. So let me see if I can put it here in, does it work when I put in?
Yes, perfect. Oh, beautiful.
Great. Yeah, so I just have a little bit of information. This won't be like a didactic panel by any stretch, but I just thought I would show some slides on the screen about our company. So at Bristol Myers Squibb, we're building the leading biopharma company in the industry, and we focus on 5 core therapeutic areas, which are oncology, hematology, cardiovascular, immunology, and also fibrosis. And we're all inspired by a single vision. We all come to work with the same thing on our mind every day, and that's what can we do to transform patients' lives through science? Our mission is to discover, develop, and deliver innovative medicines that help patients prevail over serious diseases, like I just mentioned. And our vision is to be the world's leading biopharma company that transforms patients' lives through science. So, you know, just as important as like what we do is how we do it. And we all work towards these 6 values that you see on the screen here. You know, one, it starts with integrity and ethics, right? And quality, and as the cornerstones of everything we do and how we work. We also strive to bring a passion and dedication to delivering exceptional results for our customers and our patients. We pursue innovations that are bold and meaningful, and we all act as accountable owners of the business and stewards of the company's resources as if they were our own. We act with urgency to deliver with speed and quality because we know patients are in need of solutions. And we work together with inclusive behaviors to bring in diverse perspectives and maximize everyone's potential in the company. And we have 4 pillars, you know, in our strategic foundation as a company. One is leading through scientific innovation. You've heard me stress that a lot already. One is collaborating at the center of the biotech ecosystem. Third is leveraging global scale and agility. And last but certainly not least, it's all driven by the best talent in the industry. And just in terms of our geographic footprint, we have sites in over 50 countries around the world, and many of our colleagues as well are field-based in various countries around the world, either from a commercial or a research standpoint as well. So that's just my upfront slide section there for you.
Awesome, thank you. Yeah, it's so interesting with, you know, this global company you know, many companies, of course, have really intensified their focus on DEI since, you know, this past year. Of course, we had the horrible murder of George Floyd, and coming on, you know, the heels of Me Too, and then, of course, this pandemic. So I'd really love to understand, you know, some ways that BMS, being a major pharmaceutical company, what some of the ways, you know, you're, you know, really fostering these kind of commitments, both as the company and the foundation, because I know there's 2 different ways that you're doing that. So I'd love to, you know, hear a little bit more about the health equity specifically, maybe also define what health equity is, and then what you're kind of doing as a company in terms of DEI as a whole. So Kemi, maybe you can tell us a little bit about the company, and Patty, you can tell us a bit about what the foundation's commitments are.
Yes, definitely. So, although we've been on a health equity journey for many years, the pandemic and really, unfortunately, the ongoing social injustices really shined a critical light on health inequities. So last August, we deepened our commitment to health equity and announced that BMS, the company, and BMS, the foundation, will each invest $150 million to address health disparities, clinical trial diversity, supplier diversity, employee giving, and workforce representation. Under the company commitments, 50 million will be used for corporate giving grants executed by my team in patient advocacy, while the remaining 100 million will be used for our patient affordability and support services. We're working on clinical trial diversity to increase our clinical trial sites in more racially and ethnically diverse areas in the US. We're also committed to spending globally $1 billion to work with diverse suppliers in our everyday businesses and operations. And then we have our workforce representation goal to achieve gender parity and to increase executive representation of Black and Latinx employees. So that's the company side. Patty, you want to talk about the foundation?
Oh, you're on mute, Patty.
Thanks, Cami. So the foundation, first of all, has had a health equity mission for over 20 years. So we've been in this work and very fortunate to have been supported by Bristol Myers Squibb company for this work. So in the health disparities area, we'll also be investing 50 million in health equity grants. On the foundation side, we're very interested in putting resources in the hands of the most innovative thinker-doers in the health equity space. A lot of time describing health disparities and not so much action against them. So we really try to help those action-oriented folks to try ideas out about how to best reach underserved populations. In clinical trial diversity, we're investing $100 million in a 5-year initiative to increase the diversity of investigators in clinical trials. We know that in care and also in clinical trials, it really does help patients when there's concordance between their identity and their background and the person who's taking care of them or who's the clinical trial leader in the program, or if someone's had a lot of cultural competency training, come to life in such a way that they've gotten a lot of that naturally. So 250 investigators who are diverse and also serving underrepresented communities that haven't participated so much in clinical trials. And then in employee giving, I can tell you this does not happen very often that the foundation doubles its match, but this was really, really important to our board and to our team to invest in help our employees who are so committed to addressing health disparities and discrimination, to be able to have their dollars and their commitment go even further. So we're doubling their match there.
That's amazing.
And just one thing
go ahead, Paul.
I just wanted to add real quick on the clinical trial diversity work that Patty just mentioned. Even though it's sponsored by the BMS Foundation, this will be, these 250 investigators, they will work on all industry studies. This isn't like they just get to work on BMS studies. So this benefits the entire industry, not just BMS.
Yeah, anybody who wants to be a clinical trial researcher, they could have NIH studies for the rest of their life or be sponsored by Stand Up to Cancer. It's really just to build the infrastructure in the people force within clinical trial investigators. Thanks, Paul, for raising that.
That's great. And of course, we've seen the importance of that kind of infrastructure, the need for that over the course of this last year. And just quick kind of off the cuff question I had for any of you, for us who aren't part of the organization and want to kind of follow along with some of these things, will you be updating on your website, or where can we kind of follow along and see like the progress of these various initiatives?
Yeah, there's a huge commitment to being transparent and accountable. It's one thing to make the commitments, but you've got to deliver on them and share with the the world, and certainly with the folks who are hoping to be helped more by you or included more, how that progress is going. So we have already, and definitely Paul can speak to this, put out a D&I report, but August 12th is when we made the announcement last year. So we're all holding ourselves to how did we do after a year, and our internal teams, and looking to share that with our people too. Believe me, plenty of people in the company are saying, how's it going? We want to make sure we're doing well, as well as external audiences.
Yes, no, that's something we always stress here at PowerToFly, because lots of folks make the announcement, but then where can we find the information, and holding people accountable. So that's amazing. And you kind of mentioned that internally at the company, people are also putting this pressure on you all, and that kind of brings me to also talking a little bit about what is the internal company culture at BMS, especially in regards to DEI, and then specifically, of course, through an LGBTQIA lens. So, Paul, I'd love to hear, what is the culture of inclusion at the company?
Yeah, sure. I have to admit, when I first came to BMS over 4 years ago, I was coming from working in very progressive Manhattan. And honestly, based on admittedly very little information, I really didn't know what to expect from the BMS culture. And I made some assumptions perhaps based mainly on geography, but I have to say, working here has been really a wonderful experience, both from a work content perspective, just all the great things that you've heard us already things we get to work on, but also culturally with our colleagues and partners. I'd say the culture overall is very friendly and collegial, without a lot of hierarchy, unnecessary formality and things like that. And people are both very mission driven while also making space to be open and inclusive. I think a great example of our culture actually is how we pivoted quickly during the pandemic to new ways of working from home for many of us. And the many ways that both the company and also our employee resource groups supported colleagues in making those adjustments, and also in being flexible on how people worked, as well as the company's go forward approach to remote work. I know it's a question that comes up a lot, so I'll just say it at the outset. At steady state, once we're all back in the office, BMS is enabling all colleagues to work remotely up to 50% of their time with alignment from their managers. And so that creates a lot of flexibility for the workforce. But one of the areas that I want to touch on that we focus on a lot is, and you mentioned it at the beginning, Rob, is creating a culture where all colleagues feel fully comfortable bringing their full authentic selves to the workplace and fully engaging. And so that's not just about enabling LGBTQ folks to be out of the closet, so to speak, although that's one area, but many people cover aspects of themselves for many reasons, usually out of concern for negative perceptions. And so from leadership on down, we've stressed a lot that everyone needs to be able to be themselves, so that they're not distracted or concerned about personal judgments that aren't really relevant, to their work or their potential. And in fact, this notion of covering is an area that my organization, the Pride Alliance team, has focused a lot on through our live programming, as well as on-demand videos and other engagement opportunities we create. A second big aspect of our culture is educating all colleagues about using inclusive behaviors through a program that we call Possibility Lives. Possibility Lives is centered on fostering and growing 3 behaviors, specifically around encouraging every voice, exploring new ideas, and eliminating barriers. It's a really neat program grounded in science and habit formation, and it really speaks to creating specific actions to drive belonging. And then the last I should touch on, given my role, is our resource group strategy. We call our affinity groups here People and Business Resource Groups, or PBRGs. And the name is very intentional to show that it's an equal focus on supporting our colleagues and communities, as well as driving insights, innovation, and results for the business. Each of our 8 PBRGs has a full-time lead like myself, actually, who's charged with developing a business plan and marshaling the talents of a volunteer organization to deliver on that plan. And it's been a great win-win both for our communities and the company as well. So I know I've been talking a lot about our culture, but I'm also curious about my colleagues here, their perspective on our company culture too.
Well, Paul, what I'll add is that one of the things I love about BMS is how entrepreneurial you can be and trying out ideas. we're building in health equity on a long legacy of work in the area. They'll talk a little bit more about, but HIV/AIDS was really what's given us all our best ideas right now. But it really was the people and business resource groups and a number of people in there standing in their function, their expertise, as well as being in the PBRGs that helped through. It really was a grassroots effort to bring to leadership that the company needs to take a health equity approach in everything that we did end to end, and to expand beyond really important philanthropic efforts, really important service efforts, individual efforts across the whole place, but tie it all together and really put a stake in the ground to say, we are only doing well and excelling if we're taking a health equity approach and keeping all patients in mind as we look to bring forward these innovations. So, that was just a wonderful connection between the entrepreneurial opportunity and employees bringing ideas to leadership and them saying, let's go with it. And just the commitment of the PBRGs to have made, there's a lot of time on weekends. There's a lot of research people were doing on their own and meeting informally beyond their jobs, but really that sort of people power within BMS really has made a difference and is the reason why Kemi and I are in our roles now.
Yeah, and for me, BMS is the first company that I've been at and stayed at since I graduated with my PharmD degree. And I've stayed for many reasons, including the cultural, the company culture and the people. Like Paul and Patty mentioned, I'm also very involved in our PBRGs, particularly BOLD, which is our Black Organization for Leadership and Development. And I think that's been really critical to my development and growth within the company. As a young Black professional, BOLD offers not only a community to network, but colleagues to learn and really develop from that look like me. And similar for all the other PBRGs and just learning from different communities as well. And additionally, as a pharmacist, I definitely took a non-traditional route. Didn't end up working at the corner store or a hospital pharmacy, but I got this amazing opportunity to work at BMS and really pursue my passion, working with nonprofits and patient advocacy groups to really make an impact. And like Patty said, what I love about BMS is that there's so many opportunities for growth and exploration. I could work in the medical department, commercial, corporate affairs, or any other department. And the company really encourages that because they know that that's how you develop well-rounded leaders.
That's great. And I'd imagine working for a global company, so many of the trainings and cultural value system that you talked about is even more important because you're working with colleagues that are not in your country, might not share, parts of your culture, especially maybe around the LGBTQI kind of perspective. So getting everyone on the same page in that way. I think we've also all seen that as we're moving, increasingly into hybrid situations or remote work, the importance of that strong company culture and value system at the core. That way everyone can be united, even if they are not physically in the same office, whether they have a hybrid or remote system or whether they're like Bristol Myers Squibb and are a global company all over the world. Yeah, that's great. And I kind of love to also talk a little bit about BMS's company culture and how it supports or reinforces that health equity work that you're all involved in. Patty, you mentioned a little bit about some of the HIV/AIDS work that the company is doing. I was just recently listening to Dr. Fauci on WNYC, really talking about, his work in that field and how it really did pave the way to so many of the advances we made in terms of the COVID-19, pandemic as well. So love to kind of talk a bit about that synergy between the company culture and the health equity work, and maybe specifically about the HIV/AIDS work that you're all working on.
Sure. And we're out of the HIV/AIDS business, but certainly it's gave us, many lessons that we take forward, including our work now in monoclonal antibodies for COVID 19, knowing that everybody will be getting the vaccine and that we'll need to reach into communities around the world to have a treatment option there as well. Well, it really starts with BMS being a patient-centered company. If you come and visit us ever, or I don't know if you have had a chance, but you'll see there are patients and patient stories all around our building. And we're always asking this question of who are you working for? And, you know, there are certainly patients even among our own employee base, people facing cancer, facing multiple sclerosis, cardiovascular disease, rheumatology, et cetera. So this patient-centered focus, I think, is really unites everybody, because I'm sure everybody in the building could have chosen to do a lot of things with their lives. This is what they choose to do, and to have mission-focused work, purpose-focused work that's making people's lives better. I mean, there's no greater privilege, you know, in terms of how you spend your day. It's a lot of time working over a career, and to be able to pour it into that is really, really important. And with that strong basis and a focus on patients, as we move forward with the health equity work, it's really being inclusive. You know, who aren't we working for yet? How are we going to bring them into full view, understand their needs as well, and reach them with our science, with our products, and with our services, and also with our partnership and alliance with them too, in terms of other things that they are facing in their lives as well. So, you know, the HIV, I came into BMS in 1997. That was right at the moment. BMS is a big HIV company, right at the moment where we went from having nothing for people living with HIV and the kind of outcomes that resulted from that to highly active antiretroviral treatment, which, you know, some people called it the Lazarus effect. People were really ill, but as a consequence of these medications, were able to reclaim their health and their lives. So, but we know that there were inequities with that in terms of the reach of this new tool to really address HIV outside the US. So between the company work and the foundation work, we joined the global response to HIV. And like I said, that's really where we got the playbook. And there were so many disruptions, and we owe so much to the LGBTQ community for the advocacy, the ideas about how to disrupt and change things. Things don't have to keep going how they're going now. You know, they're not accomplishing what we need to accomplish. You know, our community is dying, and we need a different kind of result from you all. So just getting a lot of ideas from them about how the FDA could operate differently, how clinical trials could be done differently, how we could work with communities, not just for treatment, but also for prevention and for getting tested and getting into care, being supported otherwise in terms of what you need to. So like I said, this has all been part of the lessons that we take forward in the company, and just knowing that, you know, the medicine part is not enough, that a person is not their disease, that there's a lot going on in their lives otherwise. And so how can we help them to address the disease that they are facing, and then live the life that they want and make the contributions that they want to their family and community, society overall, and live, you know, as fully as they can. So these are just some of the really, really important lessons that we learned, you know, community outreach and engagement, listening to communities, understanding their needs, partnering with them. You know, BMS partnered so closely with LGBTQ organizations, up and down, whether they were direct service organizations, whether they were publications to get the word out in terms of what's going on, what opportunities were, what the science was, to give input. There was such strong engagement there that is really a core principle of how we go forward, is strong community outreach and engagement, to listen, to partner, to understand what the needs are, and really stand in the shoes of the person who is facing a very difficult disease and yet has many barriers to accessing healthcare and to accessing the support that they need as well.
Thank you. Yeah, that's amazing. And just on the left, the television show Pose just ended this past Sunday, and they mentioned the Lazarus effect. They called it that as well, and talked a lot about some of the issues that you were saying about the disparities between the different communities, and really, you know, the need to listen and to walk in other people's shoes there, especially looking at it through an LGBTQ lens. So that's amazing. And I'd love to kind of, segue into talking a little bit more about how BMS's approach to addressing health equity has evolved, specifically really over the past year. Maybe Kemi, you can, give us some, also specific health equity activities that BMS has engaged in, especially over this year where, things have radically changed for so many of us.
Yeah, definitely. So lots of things going on, internally within the company. We went over our overview of commitments from the foundation and the company side. But I just want to give a little bit more detail from the patient advocacy side. So in late 2020, we actually announced 56 grant recipients. And these are nonprofit organizations that are focused on advancing health equity. And this is in the United States. They're doing this by delivering programs to improve access to high quality care, increasing disease education and awareness for medically underserved communities, and improving diversity in clinical research. So we awarded these grants in response to a special health equity request for proposals that we sent out, and we awarded 11.1 million of the 50 million in corporate giving grants that I mentioned earlier. The grant recipients, they included patient advocacy and community-based organizations, health equity coalitions, medical societies, nonprofit healthcare institutions, and others. And they're actively working right now, to deliver on those programs. Many of them are 1 to 2 year programs. And, we talked a lot about accountability earlier, and we're also looking for that in our external partners as well. So they'll be tracking their metrics, including how many individuals were served, the demographics, and any other indicators or measures to really show that they made a positive impact on the community that they were looking to serve. There's so many amazing organizations, and I always struggle to pick a couple to highlight, but I was wondering if I could drop in the chat. We released a press release that kind of has a full list of all of the groups that received funding, and you can feel free to take a look there. But I did just want to touch on, it's not just the support that we're giving them, but we're really looking to make sure to include the diverse patient voices from our external partners through these advocacy organizations and other external stakeholders, and really bring that perspective into what BMS is doing internally as well. We've had health equity advocacy summit. We have this platform where we're incorporating the advocate voice into our clinical trial process. We're looking to make sure to incorporate it into our marketing and patient education materials as well. So really holistically working with partners that have trusted relationships with the underserved communities.
Thank you. And we'll share that, Meg, we'll share that press release link on our site where everyone else is watching us. So everyone can check that out and see a little bit more. And this kind of goes into a little bit more kind of what you were talking about, but, all of this work, can't happen in isolation. So you're of course giving these grants to these other companies, these other organizations, working in partnership with them, keeping them accountable. They're keeping you accountable. And I love to, kind of hear a little bit more about, how do you partner with other groups to advance these efforts? Are there particular, ways that how do you find them, and what are other ways that you're, really striving and driving this forward?
Definitely. So, you said it, we know there's still so much more to be done, and we can't do it alone. So our success, we really have to listen and also collaborate with other stakeholders that are committed to health equity, that are committed to serving various communities, whether it's the LGBTQ community, Black patients, Latinx patients, patients in rural communities, or those that speak different languages. And really the only way that we're going to make progress is by continuing to take those bold, deliberate actions and working with these different groups. In the past, from an advocacy perspective, we have kind of focused on various therapeutic areas, you know, going and working with cancer specific or cardiovascular specific, but now we really want to take a broader approach, working with groups that have relationships and targeted health equity programs towards those various medically underserved communities, and also working to connect them too. It's all about connections and collaborations, and we don't want anybody working in silos, or you're not going to achieve anything.
Yeah, and on that note, kind of, Paul, what are some of the initiatives that the Pride Alliance is doing? Are there other groups that you're specifically partnering with, or, you know, maybe just some stuff that's being created internally?
Yeah, no, thanks for that. And I just want to first underline something Kenny just said, you know, about just the way BMS has thought so broadly and inclusively about health equity. A lot of organizations kind of, it starts and stops maybe with based on gender or race, but BMS is really thinking expansively about it, inclusive, as Kenny said, of LGBTQ, you know, socioeconomic status, people with disabilities. And so it's really inclusive of all the dimensions, even those that are not necessarily as well researched. And that happens to be the case for the LGBTQ community. Because of a lack of consistent data collection on LGBTQ status at most points in the healthcare system, we actually know less about health disparities with respect to LGBTQ than we do in other communities. You know, it starts right at the doctor's office. It also happens at the ER. It happens in health registries, even frankly in industry clinical trials. We don't consistently collect LGBTQ data, and so we don't know as much about what are the disparities and how might we address those. So that's an area that we're focused on, you know, raising awareness of that and what can we do to add to the body of knowledge on LGBTQ health equity. So two specific areas we're focused on. One is patient-focused. We've supported the largest ever survey of LGBTQ cancer survivors to understand their experiences in diagnosis, treatment, and survivorship with cancer. You know, and we suspect it's going to read out actually at the end of this month, and we suspect it's going to show that this community faces, you know, additional challenges above and beyond what mainstream cancer patients face. And we're hopeful that it points us to solutions that we can get involved in terms of patient and provider education to support them. And a second area is on oncologist education, I should say. There's a group down in the Moffitt Cancer Center in Tampa, Florida, that has developed LGBTQ training specifically for oncologists, which is very unique. And BMS, Pride Alliance, and the BMS Foundation have jointly sponsored actually a randomized clinical trial to test this training to see how impactful it is on oncologists, on their ability to work with their LGBTQ cancer patients. And I should say, it's not just cultural issues like pronouns and how you communicate, but there's real health considerations. You know, for example, a patient who's on hormone therapy has different considerations when it comes to their cancer treatments. And oncologists need to know that, and they have different risk factors in terms of screening for different types of cancers. So these are things that oncologists need to know. Not all either have familiarity with such knowledge or comfort with it. And so that's the point of this this education that we've sponsored, this clinical study. So we're hopeful that the study reads out positive in another year or so, shows benefit of this education, and then we're going to work to see how we can expand its utilization more broadly.
That's great. Yeah, and that's so interesting what you said about the fact that the data isn't always there for the LGBTQIA community. And that's when you really think about it in terms of gender or race, you know, it might be more apparent in many situations, but it's not always there. We actually had someone from the LGBT Chamber of Commerce earlier, and he was just talking about that if you put all the money together, that LGBT owned businesses, not even the people who frequent those businesses, but own businesses. But in a lot of cases, people are not declaring that in the same way they might be declaring I'm a woman owned business or a Black owned business. So it's very interesting that there still is that culture there. And, you know, something hopefully summits like this are, you know, hoping to change that. We're working on changing that. And of course, all the amazing work that you're also doing in regards to health disparities. That's wonderful. Love to just see if there's any questions from the audience. Feel free to put them in. I'm going to ask our audience one more question. Our panel one more question before we lose them. But before I ask that, Paul, love to just kind of hear, where can we find more about Bristol Myers Squibb? There might be people on the line who are, looking at new opportunities. So, if they're looking to work for Bristol Myers Squibb or just maybe learn more, where would that be?
Yeah, that's great. Thanks for that, Rob. And I just put in the chat, and hopefully they can pass it along to the folks watching. I would encourage everyone to check out our careers website. There's a ton of great opportunities available now, and we are definitely in a hiring phase. So, we welcome all diverse talent at BMS of all stripes. So definitely encourage, first of all, everyone to check that out. And in addition, let me see if I can walk and chew gum at the same time.
And while you do that, Paul, too, I was gonna point out, I know we have a pharmacist on the line, but I have been told from past BMS events that you do not need a pharmaceutical background for many of the roles at BMS. So I know that can be scary to people. It's like, wait, I'm not in pharma. Like, why would I apply? But I know that's not always the case for most of the roles.
That's definitely true. And Rob, I just have a little diversity story to share in my own part. I mean, I made a huge career change when I came to BMS. I was in academics teaching, cultural studies at Vassar and coaching, and came to BMS. And I had sat in front of a lot of people who were like, what am I supposed to do with you? But I came to BMS and folks were so open, really valued the experience I had had. Not only in teaching, but some policy work I had done, that I had lived internationally. So BMS really 360s people to see how they can help the company and tap into those strengths and those different abilities.
Yeah, that's great. And agreed, but BMS looks very expensively in terms of like qualifications when considering hiring people. I just want to share that we do have a really neat virtual recruiting event coming up at the end of the month on June 29th at 5 o'clock Eastern time. We've been hosting quarterly virtual recruiting events of the whole year. And this one's going to be focused on commercial, so like sales, marketing, medical, value access, pricing roles. And it's going to be a really neat opportunity for folks out there to meet some of our leaders in the company who are LGBTQ and hear them speak and get their perspectives, both on their roles, but also the company culture as well. And then there'll be time at the end you can see for smaller group discussions in breakout rooms based on different functions. So I put I know that registration link is quite long. I put it in the chat, and if folks could share that as well. We welcome anyone who's interested to join us on June 29th for that.
Awesome. And people can take screenshots or stuff like that so they see this. That is amazing. And also I'm going to point out that BMS also has a page on PowerToFly as well. So you can apply to roles directly through that page. We also have some videos from previous events we've done together, and also some more information about the company. And before I lose you all, we can do like a little lightning round question for you all, which is the question I love to kind of end these conversations with, which is, if you could go back in time, however many years you want, but if you could go back in time and give your younger self just one piece of advice, what would that piece of advice be? And whoever wants to start, who's ever got their answer first?
That's a good one.
That is a good one. I would say just have confidence in yourself that you can add so much value, that, it's at least a case of BMS, that this is such hard stuff that we work on, that we really need everybody. And that, you could feel, oh, I'm going into a scientific field. I don't have all this training. How am I going to help? When, health is everything. It's everything from anthropology to science to government affairs and so on. So we need everybody, and just have confidence that both in who you are as a person and the things that you've known and gained skill in, that has such value. And as long as you are really interested in the mission of an organization, then don't question yourself at all. Just go for it, I guess.
Yeah, and I feel like along those lines, I would just say, don't be afraid to try new things, go new places, and meet new people, because you never know what you're going to learn. And that's how you meet diverse people and get diverse perspectives. And it's not just what you have grown up and what you're used to. I'm fortunate. I was born in a different country, and then I came here, and I've traveled quite a few places, but I would encourage people to try to do that as much as they can, whether it's in person or virtually. Now you could be in a whole other country on your laptop learning about different things. So that is a huge part about, just being a diverse and inclusive leader, and very important for health equity as well.
Paul, want to wrap us up?
Yeah, I mean, my thoughts were really similar to Patty's and Kemi's. My initial gut was to take me in a similar place. Have the confidence. Trust your instincts. You know more than maybe you appreciate, and you have a good judgment, perhaps better than you appreciate earlier in your career. And I would build on that and say, for folks out there wondering if they could be out of the closet at work or not, I would just say, have the confidence, give it a go. Most likely it'll work out great, and frankly, if you encounter an unfriendly environment, well, that tells you something too, and maybe that's a sign that you're not in the right place. So I definitely would say go for it.
Awesome. Well, thank you all for going for it today and being here at our Pride at Work Summit. I'll invite our wonderful co-host Meg back on. But thank you all again for your time today. We'll definitely encourage everyone to check out BMS's upcoming LGBTQ hiring event, as well as, of course, your page on PowerToFly as well. So again, thank you all so much for your time today. And thank you.
Thank you so much.
Thank you for the opportunity. It was great.
Thank you all. This was an absolutely wonderful chat to get to sit on. A huge round of applause to all of you.